When we talk about revolutionizing the field of transplantation, the management of donor organs before surgery is developing into a new branch of clinical science. Dr. Peter Friend, professor of transplantation at the University of Oxford, as well as CMO and co-founder of OrganOx, is here now on this trend that is changing the practice of transplantation. Pleasure to have you with us today.
Pleasure to meet you, and thank you for inviting me.
Absolutely. Okay, you are already, in your company, already at the forefront of minimizing patients' wait time when it comes to receiving organs. How are you doing that?
We're doing it primarily by giving clinicians the opportunity of testing organs before making a decision as to whether those organs are suitable for transplant. And that means we place the organ in an environment where the organ is working, so-called normothermic perfusion, where the organ is put into a physiological environment, and we can test how well it's functioning in a variety of different ways.
And we should see greater outcomes when it comes to success rates by implementing that type of technology.
The biggest effect, I believe, will be in transplanting more patients,
okay.
But there will also be benefits in terms of the immediate and longer term outcomes of transplantation.
You've also spoken about bespoke treatment of organs prior to surgery. What does that mean? What does that look like?
Well, if there's an organ which we know has got some problem which limits its suitability for transplantation, it may be that we can do something to that organ after it's been retrieved from its donor and before it's transplanted into its recipient, so that we can make it a better risk. So, for example, livers which contain a lot of fat, they may well be working perfectly normally in the donor, but once they're cooled down and transported and transplanted, they don't work very well in the recipient, and we know that that's quite a high risk, and many of these organs are therefore not transplanted. What we are testing now is a combination of drug therapy during the perfusion phase to mobilize that fat from the liver, and a filter to remove the fat from the system, to convert an organ which has got a high risk to an organ which has a much lower risk.
Interesting. You say that the isolated perfusion technology is a game changer when it comes to transplantation. Why do you think that it is a game changer, and why has it taken so long for this technology to kind of become standard?
It takes a long time to introduce new medical technology. There are all sorts of reasons why that is. First, of course, having the idea and developing the idea into something which works, suitable for translation into the clinical environment, and then the complex and perfectly appropriate complexity of generating enough evidence to gain regulatory approval, so the FDA, and finally persuading clinicians who are very willing to be persuaded, by the way, that this is the right way to go. In other words, this is a trend, this is a change which is worthwhile.
Do you see this type of technology eventually becoming standard protocol?
In a number of centres, it is becoming the standard of care. There's no question. It's not yet been adopted routinely across the board, as it were. But there are certainly what we call the early adopters are demonstrating that as standard of care, it works very well.
We've been talking today about the fact that we're, celebrating 70 years since the first successful human organ transplant. On this anniversary, I'd love to get your thoughts on how far we've come over the past 70 years and maybe where we're headed next.
Well, I think it's been an astonishing achievement. I think transplantation is one of the absolute standout achievements of the last 50 years of medical science, if you like. If one looks back 70 years, it was extremely primitive. I mean, the surgical techniques were reasonably well developed, but everything around the surgical techniques in terms of how to look after the patients during and after the operation were very different from what they are now. Now it's routine. There's a reasonable expectation that patients with terminal organ failure receive a transplant, and that transplant restores them to more or less normal life. The fact that that's become routine and people expect it is a sign of just how successful it's been. What will happen in the future, I think the big barriers will be really twofold. The first is to ensure that everyone who needs a transplant gets one, and the second thing is to ensure that the long-term risks, particularly of suppressing the immune system, can be managed. And I think there is a lot of very exciting science just around the corner in terms of the clinic. So I think we will see some exciting changes in the next, well, not 50 years, the next 10 years actually.
which is very short when you're
Which
talking about
it is-
medical progress.
Indeed, yes.
Well, thank you so much for your time today. I certainly appreciate it.
Thank you.